have a seat here. I'm just going to present it for you, then we'll also cheers.
Perfect.
Sorry.
It's just like on Zoom, like black screens and it's tricky. Accountability and stuff. It's like therapy. It's just despair.
Okay, so thank you everyone for joining us both in person as well as online. This is our first panel of the quarter, which is very exciting. We're joined by a very distinguished panel who contributed to a report called Climate and Health Washington 2022, a special report on impacts and solutions, which was edited by Ken Lance, Howie Frumkin, and Mark Vossler. And we're joined by many of the contributors to this particular report. One special thing about this report is it was a very cooperative endeavor, both with NGOs and the university, as well as between CSDE, the School of Public Health, and the Evans School. So today for our panel, we're going to have a special setup where Howie Frumkin is going to give a short presentation on the key findings of the report, and then we're going to have a session in which we're going to have questions that were already pre-written, and they're going to answer these questions, and then we'll have a Q&A with the audience. So if you're online and you have a question for the panel, please enter it in the Q&A portion of Zoom. If you're in person, just raise your hand and I'll call on you, and we'll try and go in back and forth between those who are online and those who are here in person. First, I'm going to introduce the people in our panels, and then I'll kick it over to Howie. So our first panelist is Dr. Howard Frumkin, who is the Senior Vice President at Trust for Public Land, a national environmental organization, and Professor Emeritus and former Dean at the University of Washington School of Public Health. He is an internist, environmental and occupational medicine specialist and epidemiologist, whose career has focused on intersection of environment and health. From 2005 to 2010, he held leadership roles at the U.S. Centers for Disease Control and Prevention as director of the National Center for Environmental Health, an agency for toxic substances and disease registry, and as specialist assistant to the CDC director for climate change and health. Dr. Frumkin co-edited the report the panel is discussing today. Dr. Mark Vossler is a cardiologist practicing at Evergreen Health in Kirkland, president of Washington Physicians for Social Responsibility, co-chair of the WPSR Climate and Health Task Force, and co-editor of the report. After medical school at Washington University of Rochester, an internal medicine residency at University of Vermont. He was a cardiology fellow and then on faculty at Oregon Health Sciences University in the heart transplant program. The recipient of a clinical investigator award from the National Institute of Health for his work on the molecular biology of muscle cell differentiation. Dr. Vossler left OHSU to help Evergreen develop its heart failure treatment program and has served as the chairman of the cardiology section and the Department of Medicine there. Dr. Jeremy Hess is an emergency physician and director of the UW Center for Health and Global Environment, or CHANGE. He is a professor in the departments of emergency medicine, environmental and occupational health sciences, and global health, and an affiliate of CSDE. He practices clinically at Harborview and Montlake, and his public health work focuses in particular on climate adaptation in the health sector. So without further ado, I'll give the podium to Howard.
Thank you very much, and hello, everybody. For those in the back, if you're awkward or uncomfortable there are some seats in the front. Well, there are some empty spaces in the front. You better stay uncomfortable back there. Yeah. Quiet. Yeah.
Chair.
Yeah. Okay, sir. Yes, okay. So when the panel convenes, we may have to do some further chair rearrangement and reclamation, but it's really comfortable. But really nice to be here. Let me just get a sense of who's in the audience. Raise your hand if you're from the Evans School, please. That's a good number. Public Health School? And CSDE affiliated? Great. And anybody that I missed? Okay, Ken, we know that you. Where are you? Buster. Great. Well, welcome everybody. Really, as you heard in the introduction, it's a really nice bridge building, silo busting, cross cutting quality to today's get together. Different parts of the university are sponsoring it, but more importantly, we are coming together across the divides to talk about a big cross cutting issue. And this is to share with you this report that Washington Physicians for Social Responsibility, WPSR, issued this year on climate and health in Washington State. So I'll give you a quick run through of the report and then we'll move into discourse. This is our agenda and this is the outline of the report. So we'll talk about the health consequences of climate change in Washington. And the couple of points that I want to emphasize there are these. First, it is real and it's happening now, here and now. So often when we talk about climate change, it seems an abstraction, but it's actually right here and now. And second, we have a lot of data. This kind of recitation of health data is something that you would expect a state health department to do typically, but it's also fully appropriate and not uncommon across the country for NGOs like WPSR to do this. So we'll present the data that we collected and we'll share with you some of the sources from which the data come. We'll talk about adaptation and resilience, environmental justice, climate action is health action, and this moves us into the policy recommendations. And what you'll hear and see is that many policy recommendations outside the health sector, actually we consider to be health policy for evidence-based reasons that these are actually relevant to health. I couldn't resist a little historical romp before we get started. We know that climate change is the result of a couple of centuries of burning fossil fuels at high rates. What not everybody knows is that this was a coal area. The Pacific Northwest was a coal mining area, and that was actually very useful when people were trying to put in transcontinental trains and bring the trains into this area. This is a report from 1912, so just 23 or so years after Washington became a state, recounting all of the coal fields of King County, and you can see on the map where those coal fields were. Here are just a couple of fun pictures. This is Jackson Street, Seattle. This is several years before Seattle, before Washington was even a state. But there was a pretty good sized coal industry here, so we did our part to contribute to climate change. This was the Coal and Coke Arch that was built to greet President Harrison when he visited Tacoma in 1891. You can see the bragging about the annual output of coal. It wasn't small. And this is a coal mine in Renton, 1927. Mark lives over on the east side, and that's actually, he remembers this coal mine from the 1920s. So let's jump in. Health consequences of climate change in Washington. Well, you might not think of climate change as a health issue, but those of us in the health sciences very much do. And we typically structure our thinking around an inventory, something like this, multiple kinds of pathways through which climate change affects health. So I won't go through this. You can read this, but you can see that across the spectrum, from traumatic injuries to non-communicable diseases, heart and lung disease, to infectious diseases, to afflictions like hunger, climate change affects almost every element of human health and well-being. What's notable is that almost every one of these maps to things that we can see here and now in Washington State. So this is the list of health outcomes that we were able to document are happening in Washington State and are relevant. Let me take you through these. The first is heat. We know that we've had very hot summers recently. This is a picture of 2015, which was one of the hottest summers. What you want to look at here is the color across the state, and the scale on the side shows you what those colors mean. It's how much of an excursion that hot temperature was above long-standing temperature norms. So you can see that we're seeing a lot of excessive heating in the state. This was 2015. This was the 2021 Pacific Northwest heat wave, which had catastrophic consequences. and was recognized widely as being very, very notable. This was the New York Times coverage of it. We made national news in a way that we hate to make again. This little dot comes from that New York Times article and shows you the last few days at the time of the heat wave and how that related to the ordinary trend of temperatures over time. So we are doing a lot of record busting on temperatures around the world, and Washington State is no exception. There is good attribution work being done now, meaning that we can distinguish whether an event is just a random occurrence or whether climate change made that event much more likely. And in fact, that heat wave was made much more likely by climate change. And what followed from that was deaths. And let me just say it, climate-related deaths. And the next health outcome that we'll talk about is wildfires. We're actually having some smoke now, so this is not an abstract concept for any of us. This was a picture from 2 falls ago, September 2020, and it shows you the levels of particulate matter across Washington State. At that time, and recently this year as well, we actually exceeded Delhi in terms of the level of air pollution that prevailed. Even short durations of high air pollution levels increase mortality from cardiopulmonary disease. People who are a little bit fragile are especially susceptible. And so the excess deaths that occur when wildfires are happening are from those causes. The death certificate doesn't say climate change, doesn't say wildfire, typically it's going to say heart attack or pulmonary disease, but these are climate change driven deaths as well. I'm going to skip through this. Harmful algal blooms. These are conditions in waterways, either freshwater or saltwater, either offshore or lakes or rivers inshore, where various species of algae overgrow. And some of those produce toxins. Some of the toxins are shown on the table to the right, and some of those toxins do cause disease in humans. We've actually had quite a big problem in Washington State in recent years with harmful algal blooms and with exposure to the biotoxins that they articulate. This was a May 2021 slide showing beach closures that had to happen as the result. And the changing in temperature is a part of the contribution to that complex phenomenon. So another health pathway. Infections. We fortunately do not have a lot of tropical diseases happening in Washington State. The term tropical disease is a reminder to us that infectious diseases exist in particular ecological niches, hence tropical. And as those ecological niches expand their geographic range, so may the diseases expand their range. That includes coming up as far north as Washington State. This is a picture of vibriosis as tracked by the State Health Department. Vibrio is a genus of bacterium, a different kind of Vibrio than the one shown here is the one that causes cholera, feared diarrheal disease. This is not a cholera-causing condition, but it is an infection with an infectious agent that seems to be increasing with climate change helping to drive that. Next health outcome, allergies. Who here has any allergies? I don't mean to ask for private medical information, but not surprising that almost half the room raised a hand. Very common conditions, becoming more common for reasons that aren't fully understood. And climate change is bad news for those with allergies because the allergy season expands as the weather changes. This is a picture of forecast for tree pollen season in the Pacific Northwest. The picture on the left is baseline. The picture on the right is projected levels of the tree pollen season. And you can see that the curves on the right are higher than those on the left, indicating that all the projections are that we'll see longer duration and higher levels of various tree pollens, including those that are allergenic. We don't have evidence on the final health impact that I want to mention, but I want to mention it anyway because the mental health impacts of climate change are becoming better and better recognized. These are a smattering of recent headlines. We actually need a lot more evidence than we have on the mental health impacts of climate change. Anxiety, depression, and that's sort of population-wide. That doesn't even count the impacts on people who suffer a disaster, who suffer upending of their lives, who suffer displacement, where the mental health consequences are considerable. Speaking of displacement, we expect a fair amount of sea level rise along the coast. Now, More in some places, less in other places, because we are continuing to enjoy, the upwelling of some of the land along the coast. So some areas are actually relatively protected and will have less sea level rise, relative sea level rise than you might expect. But other areas will have quite a bit more sea level rise. The impacts of sea level rise were already being felt in particular by some of the tribes. So the Quileute tribe and the Quinault tribe both have undertaken initiatives to relocate. And that relocation will become a widespread phenomenon nationally and in other parts of the Washington coast than on tribal lands. That in turn upends people's lives and will contribute to mental health disruption as well. And the last piece I want to mention is lost livelihoods. My favorite picture to represent this concept is this one from the Roosevelt Memorial in DC. Losing your livelihood, upending your way of life is very, very disruptive and destabilizing, harmful to mental health, harmful to physical health. And one example of how we expect that to happen, it may already be happening, is in shellfish harvesting in the state, but it also applies to a number of other kinds of livelihoods, such as agriculture, where climate will bring about very disruptive changes that will in turn disrupt healthcare, physical health, and mental health. So lots of impacts of climate change on health here and now in Washington state. Adaptation and resilience, just a few things to say about that. There are some all hazards approaches that we can use to adapt to the depredations of climate change. Neighborhood networks, strong neighborhood links are a good resilience mechanism against any kind of disaster, be it an earthquake or a climate related storm. Early warning systems are helpful, and there are many others. Other kinds of adaptations are hazard specific, such as those we do for heat, like cooling centers, like planting more vegetation to cool down hot neighborhoods and so on. Infectious disease, warning systems, surveillance systems, and so on. And in our healthcare system, we are especially mindful of the need to adapt and be resilient. Like if your hospital is in a flood zone, don't put the generator in the basement, put it upstairs so that when there's a flood, the generators still function. That was advice that the New York hospitals would love to have heeded before the disasters there, Sandy and others. Environmental justice, key to everything I've talked about is that we're not all equally susceptible to the impacts of climate change. BIPOC communities, poor communities, disenfranchised communities are almost always more in harm's way than those who are more fortunate. Environmental justice is a very big theme running through this report. We drew on our affiliation with Front and Center, another very good community-based NGO coalition, and used mapping to identify where in the state the vulnerabilities are the highest. This map, the eye is drawn to the south central part of the state, but what is a little less obvious is that along the Duwamish River, South Seattle and south of Seattle, there are pockets of great vulnerability as well. So any policies we implement to tackle climate change have to be based in environmental justice considerations. Climate action is health action. Okay, what do we do about all of this? Well, it depends on where your emissions come from. What policies are going to be most effective at reducing your emissions? This is a picture of Washington's greenhouse gas emissions. And what I want you to notice is the transportation accounts for almost half of our greenhouse gas emissions. That's in contrast to the national picture where transportation is just over a quarter. So we have a relatively clean electric grid here, thanks to hydropower, one of the more renewable dependent states in the country. And that means proportionally transportation takes on a bigger role. So transportation needs to be high on our list of policy targets. Not to say that energy doesn't, but what you do is you tailor your policies for the state that you're in. Luckily, the policies that we want to propose and that we recommended in this report happen to be not only climate policies, but health policies. On the left here, you see three of the pillars of climate action: clean energy, well-designed cities that reduce energy use and demand, and healthy, sustainable diets that reduce emissions from the food sector. On the right, you see all of the public health priorities that we would love to attack and reduce the burden of disease. Well, here's the good news. Clean energy, demonstrably through evidence, documented pathways, delivers all of the benefits shown to the right through pathways such as cleaner air. Well-designed cities deliver all of the benefits indicated here. healthy, sustainable diets deliver all the benefits indicated here. So climate policy is health policy. The co-benefits lie mostly through clean air, through enhancing physical activity as we shift from motorized travel to active travel, through nature contact as we build green infrastructure, which by the way delivers park and green space exposure, and through a healthy, sustainable food system that improves nutrition and food availability. What are some of the solutions? Well, we talked about transportation solutions, and in each of these, we talked about local, state, and federal initiatives because we wanted policymakers at all three levels to act in the interest of climate and health as well. So I've listed here on this slide some of those policy solutions that both deliver climate benefits and health benefits. And in the energy and food sectors, further policy solutions shown here. I'm rushing through these partly because I don't want to commit the PowerPoint malpractice of inflicting on you the reading of a lot of bullet points on a slide that you can read yourself. Mostly because in the panel discussion in just a minute, we'll be focusing a lot on these policy issues. The healthcare sector plays a particular role, and those of us in the healthcare sector have focused a lot on this. We are almost 20% of the US economy, almost 10% of greenhouse gas emissions, because we're a fairly energy intensive sector. And we know what it takes to make the health sector relatively climate ready, both contributing to mitigation, reduced emissions of greenhouse gases, and adaptation and resilience. Luckily, we have some very good initiatives here in the state. We call those out in the report. The healthcare provider organizations that are listed here have come together under the auspices of the Washington Healthcare Climate Alliance and have made commitments to reduce their carbon emissions and to become more resilient. So this is a good thing. And finally, the question of advocacy. We urge our fellow healthcare providers to become climate advocates, and we think that that can happen in a number of ways because any healthcare provider is both a citizen and an institutional leader, a trusted community voice, clinician and researcher, and in each of those capacities, a physician, a nurse, another healthcare professional faces opportunities to act on the climate crisis. They're shown here. I want to focus in particular on the last one, since advocacy is our final point. We are trusted community voices. So speaking out on the climate crisis, we think is a very appropriate role for health professionals. With apologies to anybody who's not a doctor or a nurse in the room, this is a regularly repeated survey, and it turns out doctors and nurses are two of the most trusted professions in the country. And it's hard to believe that we're more trusted than members of Congress or car salespeople or telemarketers, but it's true. And that is an opportunity for us to actually use our voices to propel climate action. The Washington State Medical Association has been very, it has leaned in and it has passed a resolution and adopted policies that are shown here. So our state is among the states where the medical establishment is beginning to step up in very useful ways. We think that there is a lot that health professionals can do, letters to the editor or modern equivalent, tweets and other social media posts, expert testimony, which many of us in the room have given, public speaking, and even protest action. So the key points I want you to take from this report, which you can read, but you don't have to because I'm going to give you the cliff notes now. There is a scientific consensus about human-caused climate change. Climate change is harming health in Washington now. Anybody's health is at risk, but some people are more vulnerable, and that equity lens needs to inform what we do. These health threats will get worse with time without action. They may get worse with time no matter what we do. We can certainly protect people with good actions. There are opportunities both to tackle climate change and to improve health, and that's a really good news story. And there's a number of policy strategies that I recited in the last few slides. I won't repeat now. So big thanks to all those who contributed to the report. It really was a nice joint effort of WPSR, people at UW, people at Front and Center, people at Healthcare Without Harm, another NGO. And a nice example of how many of us can come together to tackle a big, difficult problem. Thank you. So let's bring up Mark and Jeremy.
Sure, but I don't want to.
You can, I'll just
Bring our own chairs? Yeah. Why don't you guys bring them behind? Yeah, this is a BYOC party. See if you're the moderators, you get to be hired. Yeah. I didn't want to hire.
Okay, so we're going to continue our discussion. First, we had some pre-selected questions that I believe you guys had access to ahead of time. And then we're going to open up questions to the audience. I see that we already have some online. But we're going to get to those after these questions. So the first question that we wanted to know is the report offers a comprehensive look at climate-related health issues in Washington. This report might have been issued by the state health department, but instead it was issued by a civil society organization. What do you think is the role of government public health in addressing the climate crisis? So I know that.
I've been talking a lot, so you guys take it away for a while.
Okay, I'll jump in. Before I answer the question, though, I want to acknowledge the guy whose idea generated this report. That's Ken Lands, our co-editor, long-term member of WPSR. And he's the guy that corralled a lot of our contributors together, thought of the idea and wrote substantial portions of the report himself. So want to give credit to Ken. I think I'm sheepish diving in, sitting next to an expert in adaptation. And I think that's where the public health departments are going to have to play a role, because a lot of the impacts and how we discussed are happening already, and they're going to get worse. Even if we do a great job with mitigation, reducing emissions, we have to have policies in place and structures in place that help us with adaptation. And I'll stop there because Dr. Hess has been doing research in this area, so.
Yeah, I agree. And so I wish that our state climate and health program had issued this report. It certainly could have been something that they wrote. And this is a bit of mild public criticism coming from me, honestly. I think that they have recognized the importance of the issue. They haven't really coalesced into an effective voice around climate and health, either the health benefits of mitigation or adaptation. That is happening. But, you know, it would have been nice to be able to write this report leaning on surveillance that the state has done around these climate sensitive conditions and the health impacts of these different events. We still don't have great studies about the impact of the 2021 heat dome in Washington state. In fact, we're now getting a bunch of studies from other parts of the country that I'm reviewing as a peer in the scientific literature. And we don't have those estimates coming from our own public health authorities, which is problematic, I think. So their role is certainly to conduct effective surveillance, lay out interventions that need to happen, and track health impacts, health equity impacts. Also, health and all policies, connecting with other sectors and moving at the pace of the rest of government to make sure that health is a consideration in our mitigation activities, which right now are very robust. We're doing a lot and very quickly and putting a lot of money into mitigation in Washington state, which is great. And the HEAL Act is going to ensure that we bring that attention to health equity into those activities. And the health department, as well as I can tell, certainly seems to be stepping up to that. But I agree that adaptation, I think there's a lot of enthusiasm and focus on mitigation, which is absolutely essential. But even if we were to bring our emissions down to zero, globally emissions continue to grow. And so that's what's going to impact climate in Washington. And so we're going to need to adapt probably aggressively in some areas.
I'll just add one quick thing, and mostly thinking about the Evans School people who are in the room. It's a really interesting strategic and theoretical question of what's the role of civil society, what's the role of government agencies in tackling big problems. And the answer may be different now than it was 2 years ago because of COVID and because of the lack of trust in health departments that has erupted in at least some parts of the population. So it may actually be that a civil society organization of health professionals has a more effective megaphone on some issues than the health department itself. It's a sad commentary if it's true, but if it's true, we ought to act on it. The other thing is that we have an advantage that we can say some things that a health department report couldn't have said. So the whole tail end of what I shared with you from our report, the policy recommendations that flow from the health observations, that could never show up in a health department report, but civil society can say those things and draw the lines between health data and policy. So this is a nice example of the complementarity of civil society action and government agency action.
So the report emphasizes the health consequences of climate change. Is the health frame effective in communicating about climate change? Have health voices been sufficiently prominent in public discourse about climate change?
If you recall the slide Howie showed about our state medical association and passing resolutions, that's where I've personally seen a lot of effectiveness. A couple of clinicians start talking about climate change as a health issue. There's a bunch of folks in the room who hadn't thought in that frame, and it starts to snowball. And within a couple of years, you have a very centrist, Washington State Medical Association is not a left wing or right wing. It is a nonpartisan, non-political organization. They're coming out with strong statements, and they passed another couple of climate resolutions even this year, just last weekend. So that gives me a lot of hope that people are starting to get it. The people, at least in the healthcare community, are realizing, and they are activated. They are wanting to do something about it. They're wanting to speak up.
Yeah, I agree. I mean, the data and others that Howie cited related to us being trusted is real and plays out. And I think that when we do take the initiative and have these conversations, people listen and they're eager to have those discussions. I also think that the health sector is learning how to do this more effectively. That, you know, one example is environmental health. Some of you may be environmental health scientists and or training to be. And we have come to this problem by putting out a lot of information about the health co-benefits of climate action. So how much does it benefit health? And that information doesn't necessarily seem to be taken up by policymakers in the way that we thought that it would be. And so our theories of change are not right, apparently. And it probably has to do with the way that we're talking about monetization of those benefits and looking at impacts on people's lives. So we in the health sciences are learning how to speak more effectively to these audiences too. And when that happens, I think we do see a lot of traction.
Yes, okay.
I might move us more toward dialogue with the group, so.
Yeah, great. And so of the health impacts you discuss in the report, what are the greatest threat to residents in our state?
I think probably over time, it's air quality related to wildfire smoke. And that mostly has to do with how hazardous that exposure is and then the duration of exposure that we're seeing. So over the last 20 to 30 years, we've seen really remarkable progress in the United States around air pollution related to regulations from the EPA, principally in the Clean Air Act. That progress is being reversed, particularly in the Western United States, because of wildfires. And so we are now having exposures that sometimes are really dramatic, but also are just growing and more significant than they've been. So we're losing that progress, and it's day in, day out, right? This heat dome was terrible. I was practicing during that event, and I will certainly, never forget a lot of what I saw. But it was only 3 days, thank goodness. And the exposure for wildfire smoke is different. We're seeing that for long periods of time. And it's definitely having an impact on mortality. But I think you could argue about several.
Well, this is a historic moment because for the first time in 20 or 30 years of friendship, I'm going to disagree with Jeremy. We're being very semi-quantitative here, but I would say mental health impacts. And I say that because they will be year-round, unlike the wildfires. They will affect almost everybody in the state in one way, shape, or form, unlike the wildfire, which many people can endure without too much harm. And they're bound to get a lot worse. So just think of a few indirect pathways, like livelihoods are disrupted. Lots of people suffer mental health consequences. I'm fascinated by the concept of migration, which many of you in the room know more about than I do. But I'm pretty convinced that a number of cities in this country will become uninhabitable in the next few decades. New Orleans, Los Angeles, Phoenix, Las Vegas, Miami. They'll have to decant large numbers of people from where they are, and we will be a receiving area. So imagine a sudden influx of hundreds of thousands of people into a place that already has a critical shortage of affordable housing and transportation infrastructure and everything else. That's a recipe for terrible mental health consequences for a lot of people. So I think that we're going to see that problem growing, and we're woefully unprepared to deal with it.
I'm gonna agree with both Howie and Jeremy. I think forward looking, I think Howie's probably exactly right. What I'm seeing in my own practice reflects what Jeremy just said, in that I actually see folks, I specialize in congestive heart failure, so I see fairly frail people, and the wildfire smoke does precipitate cardiac events. I don't need to read the paper to know that. People come in and say, I had a really rough time. I landed in the emergency department because of the smoke. The people are drawing that connection as well, not just their doctors and nurses.
So we had a hand up in the back. Yeah.
Yeah, I was wanting to ask a question directly related to what Howie just said, so maybe now is the time. This is the thing that I think a lot about is displacement and what that's going to do. And we know that in general, lack of access to safe, adequate housing causes also a myriad of other health problems besides mental health issues. And I'm curious in terms of both mitigation and adaptation side of things. Like as demographers, it's kind of hard to quantify migration from outside. So even if Washington is studying things domestically, if we are doing better at mitigation, we have to think about displacement and dispossession of land of our own individuals. And then an even harder to quantify thing is both internal, domestic, and international climate displacement. Are people starting to think about that in the context of our housing shortage now? We can't house the people here. People are going to be internally displaced. How do we begin to plan or prepare for mitigation for unknown numbers of migrants?
I can't say that I know everything that's going on in the metropolitan planning field, but my impression is almost no place is planning adequately. We know where some of the receiving areas will be: upper Midwest, Northwest. But if you look at urban planning in places like Detroit or Chicago or Seattle, the forecasting for housing demand is based on past trends. But the past is no longer prologue. But somehow that thinking hasn't gotten through to the people who are doing a lot of the planning and forecasting. School systems, housing people, transportation planners. I think we have a lot of catch up to do, and we'll be caught unprepared.
So I had the privilege of working on the most recent 6th assessment report for the IPCC on the health chapter. It was actually interesting. The health chapter morphed into something new this time. It was health and well-being, and essentially human security. So the changing structure of communities, which was IPCC speak for migration. And so it's a much longer chapter than before. And we kind of struggled as a group because there really is no overarching formulation that brings together all of those things into a health-oriented or well-being-oriented perspective. And we weren't able to come up with one in our chapter. We did our best. We do know a fair amount about migration patterns, and certainly in response to specific events and other things. It's much more common to see internal migration than it is transboundary migration, and people tend to migrate for opportunity as much as anything else, as avoiding hazards. So we expect some of those things will probably continue, and we'll see regional migration in from the coasts and other hazards related to climate change in the United States. We'll probably see migration to the locations that Howie was mentioning. And We also, I think, we didn't review this in our chapter, but it certainly seems to be the case that we are not. There is no linkage whatsoever between that kind of thinking and planning and incentives and regulation around building, housing and other things. It just seems to be a complete disconnect. So, but I don't know a lot about that. It just, as an observer, it seems like there's no crosstalk.
So maybe this is a good point to just ask some questions. So I'm just going to ask from online. We have a couple questions. So from Delaney Glass, how often does your team consult geologists, geoscientists? What do these collaborations look like? I ask because I have heard from many geoscientists that the science of attribution to anthropogenic climate change for any given disaster, e.g. floods, is actually quite difficult. I also think about the other influences such as the flood that just happened in Kentucky. That was almost entirely caused by the coal industry there, which of course is linked to climate change. So I guess the question is how often do you consult with geologists, geoscientists?
So none of us is an attribution scientist, so I think we should say that first and foremost. I've been involved in some attribution work, and most of that has been around heat. So it's mostly atmospheric scientists who are involved in that work. I really haven't seen a lot of attribution analyses related to floods, which signals probably that it's very difficult to do, and probably that there's not a lot of positive associations that have been proven yet. But I may be either missing some of the literature. So it's a very interdisciplinary field, and the tendency is always to reach out to the appropriate people and to build a big tent. So I think we certainly would be happy to do that and connect with hydrologists and geophysical scientists as appropriate.
So are there any questions in the room? Okay, go ahead.
What are the short and long-term policy options that we have to solve some of the issues that you mentioned in your report?
Well, right now, we're in a fortunate position. Sort of an unfortunate position because we're already seeing health impacts. We're in a fortunate position because people are becoming more aware. And by people, I mean not just the general public, but our elected officials. And we've gained ground in our state over the last several years with legislature that mandates a transition to clean electricity generation, a clean fuel standard for transportation. The HEAL Act that mandates health equity, human equity, environmental justice be considered in decisions regarding climate change mitigation and adaptation. Those are big steps forward in our state. And we have, it was controversial, but we have a price on carbon and a cap and trade bill. And hopefully the money that's generated there will be funneled into projects that further promote clean energy production, lower transportation emissions, healthier buildings. So we're positioned well in Washington State. We're also positioned well thanks to the poorly named Inflation Reduction Act just passed Congress and was signed by President Biden. It really has nothing to do with inflation that I can tell, but that got it passed. But there's a lot of investments in clean energy. But the rub is you have to take advantage of those investments at the state and local level. You have to take advantage of that if you're running a business. Just because the money's there doesn't mean it's going to be spent well, has potential. What are we looking at in Washington State? Biggest sector where we can make improvements right now is the building sector. If you look at that graph, with 15% of our emissions are electricity generation, and 24-ish% is the built environment. If you add those two, it's actually the built environment as a total is 40%. So if we make our buildings more efficient and we transition off of gas in buildings to fully electric heating, cooling, and cooking, we can ramp those emissions down dramatically. And we're seeing progress at a state level, both at the state legislature and the administrative body, the Building Codes Council, is trying to move forward in promoting building electrification, building efficiency. So I'm actually hopeful in the next couple of years, we're gonna see a ton of momentum there.
And so I agree with all of that, and I will add that while so a fair amount of what how we presented is a bit of a doom and gloom story for Washington, there actually is quite a bit of economic opportunity that's going to flow from these investments. And to be honest, probably some economic opportunity will flow from the climatic change in Washington related to agriculture and other things. So a balanced assessment of climate impacts, given our response from an economic standpoint in Washington, is actually fairly rosy, I think. I think adaptation is really important for us. And, you know, going back to the sixth assessment report, one of the messages that's been pretty standard in climate and health for years is health system strengthening is the most important thing you can do, particularly in low and middle income countries, which is paradoxically lay out all these risks, very climate specific. And then we say, and the best thing you can do is strengthen your health systems. But it's really population vulnerability that matters. And I think this pertains here too, that we've spent a lot of time thinking about evidence in clinical practice, and we ignore the evidence that the way our health system is organized is pretty bad for health outcomes and population health. And the US is increasingly an outlier in its willingness to ignore certain kinds of evidence. Gun violence is certainly one, and healthcare delivery and system structure is another. And so I think we have an opportunity to do some things that don't really have to do with climate change, but actually would significantly increase our resilience to climate change. And this pertains to Washington. One of the biggest issues that we are facing right now in Washington is a crisis of healthcare availability. And I feel this every day in the emergency department, where we're very sensitive to this, the emergency department here, but it's statewide. We just don't have enough beds. We don't have enough long-term care beds. We don't have enough subacute care beds, and we don't have enough acute care beds. And it's a problem. And it's not a problem. It's a problem that has to do with the administration of healthcare in Washington. And so we need to be thinking about these things. We need to be thinking about demographics going forward and healthcare needs and all these things in Washington a little bit more of a forthright way, I think.
Yeah, the COVID response really illustrated this capacity problem, because we were running hospitals at near max capacity, because that's, if you're a hospital administrator, that's kind of an efficient way to do business. But then if you have a surge, an unprecedented surge in cases of whatever, then you don't have enough nurses, you don't have enough doctors, you don't have enough techs. So when we say beds, what we mean is not just the physical place to put a patient, but the caregivers. And we saw that in COVID, that we couldn't handle the surge. We changed some things in terms of making the most use of the beds that we have, in terms of being able to transfer people from one institution to another, and then think a little more globally in a way that I'd never seen practicing medicine here for 20 years. But I don't think that's going to be enough if there are more climate related disasters. So we got to use that mindset that we learned in COVID, project it forward.
Yeah, in the back.
Thank you for the discussion so far. I've been really enjoying it. This is kind of a little bit abstract, so bear with me because I know it's not specifically purview, but your purview, but it does relate directly. How are we supposed to plan for or navigate the fact that most of our policy is ultimately up to an executive branch that may or may not be on board with any, like scientific process or any kind of advice? Because we're very lucky because we have Jay Inslee, who's very green and very interested in that in Washington State. But if you get to, the federal executive branch, obviously Joe Biden just passed the Inflation Act, but that comes down to the state government to actually enact and use the resources, as you say. So how can we plan for that in the future? What do we do if we don't have a Jay Inslee forever?
And when it comes to tackling big thorny problems, democracy is the worst possible form of government, except for all the others. But when people ask me what's the one most important thing I can do to tackle the climate crisis, I say it's vote. So we need I'm not sure I'd agree that the executive branch holds the key. I think it's all three branches. Just watch the Supreme Court in the next few years and you'll see how it can stand in the way of progress. And the same thing is true with our legislative branch. But if we vote this issue, then that will change. So plain old shoe leather activism to get people to vote, to put climate smart policymakers in place is essential.
And it's more than just voting, it's making climate an issue in the election. So it's, you know, showing up at your elected officials town hall and asking questions like you just asked us, you know, what are you gonna do about it? What are you gonna do about the climate crisis? And talking to your friends and neighbors, and what you find when you talk to other folks, there are people that think this is too political issue. They're very concerned, but they don't want to speak up because it's been politicized. So speak up, break the ice. You hit on one, you think about where your levers of action should be. EPA is frail because the whims of one administration to another. You kind of touched on that. I think I'm less worried about what's going to happen in Washington State administratively, given the political climate. That could certainly happen federally, which is why we can't ignore Congress, because they can pass laws, they can mandate that the EPA do things that the executive branch can't find. So you have limited time, call your members of Congress when you get home today and say you want them to act on climate, that the IRA wasn't enough.
I think actually it's also important to recognize the market momentums here. We're at the beginning of, but we're unquestionably in a massive transition. And it's enabled by a lot of technological innovation that's already in hand. And renewable energy is cheaper than energy from fossil fuels. It's just a fact, and it will continue to move in that direction. So that's a big tailwind. Eventually, the doubters and the fossil fuel special interests and all those other things will have to bow to those market influences. There's not much of a question about it. So you're going to see this transition, you know, spread. But I think the question is rate of change, ability to point to the evidence and to silence this doubt narrative that's come up. And that's where going out, voting, of course, but also just pointing out the facts as you see them. And sometimes, you know, democracy is great, but also China is not a democracy. China has made more progress in this space than any other country in the world in the last several decades. And that's not an endorsement of overall approach, but it's a fact that they really have made great strides, and it has had great benefits for the Chinese people and their health and global health. And so I don't think we certainly have a lot of issues from a governance standpoint in the United States, and they're getting more worrisome every day, I think. But there are opportunities in lots of different spaces and lots of different approaches to governance and decisions.
The question wasn't too abstract at all. It's a great question.
You know, I'm going to add something on the economics. I'm a little sheepish here because the last person you want to talk to about investment strategies, a cardiologist. But if you have fossil fuel companies trading at a price to earnings ratio around 8 and renewable energy companies trading at a price to earnings of 30 to 40, the people that are pouring money into these things aren't stupid. They see the writing on the wall. And the only people that don't seem to see it are politicians in states that are dependent on fossil fuel revenue for jobs. And that's something we really need to pay attention to, because that loss of livelihood cuts both ways. You could lose livelihood because you're in the fishing industry and ocean acidification is destroying the oysters. Or you could have a loss of livelihood because you're a minor. Or
Gas station owner.
gas station owner, right? And we have to be cognizant of the impacts on folks that are working in those industries, be planning for how we can help them adapt and gain employment in a clean energy economy.
Questions in the Q&A that I feel like should be answered.
Oh, yeah, so, you're talking about Tess Max? Okay, so Tess, Abramson Richards, in line with the environmental justice component of this work, was there community engagement among highly impacted communities, such as tribes, which you discussed, in crafting those, solutions in the report? If so, how did that engagement influence the solutions that were presented?
I'd like to call on Ken Lance for this one. We worked with Eric Bruin from Front and Center to write the environmental justice section. So Ken, could you comment on that?
I thought it was important for the environmental justice section to have the EJ community representative do the actual writing of that section. We didn't change it at all. As far as particularly asking the tribes to be involved in this, it's a tougher thing to do because they're sovereign nations and there's not one representative of all of them. I was a representative to the HACE, my blanking on what it stood for, was the 1631 initiative. We did involve the tribes in that. And it's an important component because the different communities don't always agree with each other. BIPOC communities don't necessarily, the tribes who have timber harvesting were in favor of certain policies with the carbon pricing, whereas other minorities were not because they've got polluting industries right there next to them. It's a complicated thing. There's no one good answer.
It's not, sometimes it's less complicated. A good example where we've been working on an advocacy front is with the Puyallup tribe, trying to block the LNG plant, PSE's LNG plant in Tacoma. The people that are going to be most impacted directly by that are the Puyallup tribe. And, you know, if it's in your own backyard, and it's polluting in your own backyard, that's going to raise your concern. Unfortunately, we lost that battle so far. It's the only, since I got involved in climate activism, it's the only new fossil fuel project in the Pacific Northwest. So it's pretty sad, but the Puyallup tribe has been very active in resisting this outgrowth of gas, and that plant is still in court.
So we are at time. So if you guys will join us next week, we have A.R. Siders from the University of Delaware, who is going to be presenting ethical dilemmas and relocation as climate change adaptation. It's very related to this report. So thank you to our panelists for answering our questions, and we'll see you guys next week. It's online only. Is that right?
And Isaiah's gonna drop, for those of you who are online, a Zoom link to hear from CSDE Computing Core. For those of you who are here, are students that want to learn about computing resources, I'll get y'all set up on the Zoom. And those of you who are registered for class today, if you could sign in on the sign-in sheet, I'm gonna put on the table over here before you leave.
Very much. Thank you, guys. I would have a little Oscars. Sit next to it. I mean, so I think like very historical stuff.